Welcome to today's lecture on right ventricular hypertrophy, RVH. In this comprehensive script, we will delve into the intricate details of RVH, including its electrical changes, underlying pathophysiology, diagnostic imaging modalities, associated conditions, surgical interventions, prognosis, and even its occurrence in athletes. By the end of this lecture, you will have a thorough understanding of RVH and its various aspects. Right ventricular hypertrophy, marked by an enlarged right ventricle, alters electrical conduction in the heart. ECG findings in RVH include right axis deviation, right atrial enlargement, P pulmonale, and repolarization abnormalities, ST segment elevation in V1 V3. Moving on to our next topic, let's explore the role of pulmonary hypertension in the development of right ventricular hypertrophy. Pulmonary hypertension refers to increased pressure within the pulmonary circulation, which may result from various etiologies. When pulmonary hypertension develops, it imposes an increased afterload on the right ventricle. As a compensatory mechanism, the right ventricle undergoes hypertrophy to cope with this increased workload. Over time, this can lead to right ventricular hypertrophy. It is essential to note that pulmonary hypertension can be caused by several underlying conditions, including chronic lung diseases, left heart failure, congenital heart defects, and even genetic mutations. The presence of these conditions further contributes to the development of right ventricular hypertrophy. In conclusion, pulmonary hypertension plays a significant role in the initiation and progression of right ventricular hypertrophy. Understanding the relationship between these two entities is crucial for the effective management of patients with RVH. Chronic lung diseases, like COPD and pulmonary fibrosis, cause inflammation, which releases cytokines and growth factors. This inflammation leads to pulmonary hypertension and chronic hypoxemia, stimulating vasoconstriction and contributing to the development of right ventricular hypertrophy. In this section, we will discuss the different imaging techniques used to evaluate right ventricular hypertrophy. Echocardiography is commonly used and provides real-time visualization of the heart, assessing size, thickness, and function. Cardiac MRI offers detailed evaluation, while CT and nuclear imaging techniques provide additional information. Now let's explore the relationship between tricuspid regurgitation, TR, and the development of right ventricular hypertrophy. TR refers to the backflow of blood from the right ventricle into the right atrium during systole. When TR occurs, it imposes an increased volume load on the right ventricle, leading to ventricular dilation and subsequent hypertrophy. As the right ventricle hypertrophies, it strives to maintain adequate forward flow, further contributing to the progression of RVH. It is important to note that TR can occur due to various etiologies, including primary valve pathology, such as tricuspid valve prolapse, or secondary to other cardiac conditions, such as pulmonary hypertension or left heart failure. Identifying the underlying cause of TR is crucial for appropriate management and targeted treatment of right ventricular hypertrophy. In summary, tricuspid regurgitation exerts a significant impact on the development and progression of right ventricular hypertrophy. Recognizing TR and its associated pathologies is of utmost importance to ensure optimal management of patients with RVH. Right ventricular hypertrophy is common in certain congenital heart defects, such as tetralogy of Fallot. Mechanisms include increased pressure or volume load on the right ventricle. Management involves surgical interventions to relieve the load and improve function. Genetic mutations, particularly those affecting desmosomal proteins and calcium handling, contribute to the development of right ventricular hypertrophy. Genetic testing helps identify these mutations for risk assessment and personalized management of patients with RVH. In the video on hemodynamic changes in right ventricular hypertrophy, we discuss the physiological alterations that occur in the hypertrophied right ventricle. We cover increased contractility, impaired diastolic filling, abnormal septal motion, and increased arrhythmia susceptibility as key changes to understand for management. Surgical interventions, including septal myectomy, tricuspid valve repair/replacement, and heart transplantation, are effective options for managing right ventricular hypertrophy. Individualized decision-making and a multidisciplinary approach are crucial for successful outcomes in each patient. Right ventricular hypertrophy, RVH, increases the risk of arrhythmias, such as ventricular tachycardia and atrial fibrillation/flutter. Management involves medication, implantable cardioverter defibrillators, and catheter ablation to eliminate the arrhythmogenic substrate and improve patient outcomes. In the video, we discuss the prognostic evaluation and long-term outcomes of right ventricular hypertrophy, RVH. Factors influencing prognosis include cause, severity, functional capacity, comorbidities, and risk factors. Early recognition and tailored management strategies are crucial in improving outcomes. Right ventricular hypertrophy in athletes can be a physiological adaptation to exercise or a pathological change. Differentiating between the two requires a comprehensive evaluation and consideration of individual characteristics. Understanding the complexities of right ventricular hypertrophy, medical students can better diagnose and manage this condition in their future practice. It is crucial to recognize the interconnected nature of RVH with various coexisting factors and comorbidities for optimal patient care.